So welcome everyone, and thank you again for taking the time to join us tonight. As I mentioned earlier, we are going to begin with a presentation followed by a Q&A at the end. So if everyone could kindly mute their line just so that we don't have background noise, and then we'll open up lines later if anyone has any questions that they'd like to ask. Certainly going to welcome questions at the end and leave plenty of time for a Q&A at the end. So once again, thank you for taking the time to join us. My name is Kelly Coleman, and I'm the Director of Recruitment and Marketing at the Medical School for International Health. And joining me today is Beth Chesser, who's the Assistant Director of Admissions and External Affairs at the Medical School for International Health. Combined, we have well over a decade, probably almost 2 decades worth of experience in medical school admissions. So the purpose of this webinar is really just to share some insights with you. So again, we're going to host a whole series in the fall. We did this last year, and attendance was phenomenal. Students really provided a lot of great feedback to it. We really did a whole 4-part series breaking down the medical school admissions process, from essay writing to interview prep, all different things like that. But tonight we're just going to start with a basic general overview and just provide some insights, kind of try to demystify the medical school admissions process for you. Now, both of us obviously are at the Medical School for International Health, so we really have experience with how we do admissions, but talking to a lot of our colleagues at different schools as well, we're going to share some basic thoughts and experiences, not only for our school, but for others in general, that we really believe are pretty much universal across the board, as well as some things that are more specific to different schools as well. So first of all, the big question: when do you apply to medical school? And that really does, it requires some research on your part. It requires some background information. So researching, obviously, how AMCAS works. A lot of schools in the US go through AMCAS. We do not, which we're going to talk about a little later, because the international schools do not do admissions in that same way. They do that more individually on their website. So really, in terms of applying or knowing when to apply, you need to know the deadlines. You need to research the schools. Can everyone please mute their lines? You really need to research the schools and figure out what their admissions deadlines are. Some are hard deadlines. Some, like the Medical School for International Health, we operate on a rolling admissions basis. And that's pretty typical for most of the international medical schools. So we begin accepting applications in July. Applications are accepted on a rolling basis. So as a student is interviewed and gone to committee, a decision is made and communicated to that student. So we don't wait to admit everybody all at once. That's really what rolling admissions is. So some schools operate on that kind of timeline, and that's both international as well as US schools. And then other schools release all their decisions on a certain date. So really knowing what their process is, knowing if they wait and review after their set deadline, which may be a date in October, whatever date that may be, or if they're just releasing admissions decisions as they go along. The key thing there is with rolling admissions, oftentimes, if you apply earlier in the cycle, all the spots are available. If you apply later in the cycle, they may already have 3/4 of their class already filled. So that's just something to keep in mind, not only with deadlines, but again, with the admissions process and whether it's rolling or not. Getting on the radar. What we mean by that, if everyone can please mute their lines, that would be great. We have somebody joining, I believe, from a cell phone. If you can please mute that line, that would be terrific. Getting on the radar. What we mean by that, you may not have everything ready to submit to a medical school when their application's open. Getting on the radar, though, really lets the admissions team at a medical school know that you're serious about applying. You're serious about applying this year. You communicate with them. You may start sending in some materials that you already have, whether it's transcripts. Maybe you don't have an MCAT score yet and you're waiting to get that later, but you send in the transcripts, or you start your application and you submit your application with a note or an email that everything else will be here by such and such a date. That really lets the school know that you have every intention of applying early on. You're somebody that's going to be considered this cycle, and just really puts you in their, like I said, on their radar as a serious applicant for this year. Submitting an application if you have not completed all the required coursework. This is particularly common if a student does not take a gap year, is a fourth year undergraduate student, is in a post-bac program, where you're submitting your application, but you haven't completed, you haven't maybe finished organic chemistry yet, or you haven't finished a semester of physics yet. And that's fine. I know our application and many others ask for coursework in progress. And you can apply as long as you've taken enough coursework to really prepare yourself to sit for an MCAT and do well on it. It's okay if you still have some courses to complete. The admissions committee will see that. You'll note that on your application, and that is not looked at negatively whatsoever. And this brings me to the next point, submitting an application, as I said, if you've not taken an MCAT yet. You may go ahead and submit all your materials. Submitting your transcripts ahead of time is a great thing. It may take a while for your school to submit them. Letters of recommendation. Sometimes you ask for a letter of recommendation, you may have to follow up a few times, and you may plan on having it sent in a week or two, but it might take a month or two to get that in. So go ahead, submit your application, submit all the accompanying material, and just note when you'll be taking your MCAT. So you may want to apply earlier in the cycle, apply in September or October, but know that you're taking the MCAT in January. And that way, once your MCAT score is released, your application can be promptly reviewed without any further delay. On the contrary to that, if you waited until January or February and you got that MCAT score and now are submitting everything, and perhaps there's a delay in your recommendations or anything else, your application might not get really reviewed and considered for an interview until later in the cycle. So your MCAT might be released in February, but the rest of your application is not complete until maybe April, and that really pushes things out quite a bit. Whereas if you have everything else in before your MCAT score is released, once that MCAT score is released, you're good to go and get reviewed promptly. So it really just moves things along better, streamlines the process. Last but not least, we often get asked about whether students should take a gap year. Is it best to apply right out of undergrad? Should I take a gap year? Should I take 2 years? That's really up to you. There's no right or wrong answer to that. Some students are ready. They're ready to jump right into medical school, financing they have in place, and that's fine. But it's more and more common nowadays to take a gap year, or some people call it a growth year now. Perhaps you need some more medical experience, some more shadowing, some more hands-on experience. Perhaps you're doing research that you want to finish up. Perhaps there's a course that you'd like to retake. Perhaps you have to save some money in that year. You want to travel. You need a mental break from school for a year. All of those reasons are fine. It's really up to you. We suggest you consult your family, an advisor, and really make that decision. There is no right or wrong answer to taking a gap year. And medical schools, we've talked to many of our colleagues, do not look at a gap year in a negative manner or in a positive manner. It's just one more piece of your application. And the main thing is maybe you can talk about what you did in that gap year and why you took that and how that helped you grow in that year, or how you were able to save some money for medical school, or you finished a research project and it's getting published. There's a lot of things you can do in that gap year. But again, there's some people who don't take a gap year and they're ready to apply to medical school right out of undergrad in their fourth year. And that's fine as well too. There's really no preference when it comes to medical schools, whether you've taken a gap year or not. The biggest thing is you deciding whether you need to do that for whatever reason you may need to, and then making sure you accomplish something in that year. You've done something, you've grown in that year, and you can talk about that on an interview or an essay or anything like that. So now I'm going to turn it over to Beth and just mute myself here. Go ahead, Beth.
Thank you, Kelly. Good evening, everybody. Thank you for joining us this evening. So now Kelly's reviewed with you when you should apply. Now let's look a little bit deeper into your actual application. Some of these themes will overlap a little bit, and you might start to see a common denominator. For starts, when you start a medical application, where are you applying? Do your research before you do. There's a lot of medical schools. Try to gain as much information as you can about the schools you are thinking about applying to. I always tell applicants, just as we look at applicants and review them, they should be reviewing schools, because it's very important that the school is a good fit for you and what you are looking for in medical school. If it's a good fit, you will thrive. And if it's not a good fit, it'll be more challenging for you. So do your due diligence and figure out where you want to apply. Does the school emphasize research if you're very research oriented? Does the school emphasize service? And so forth. In addition, when you are applying, know what their prerequisites are. We'll talk about that in a minute. Connected to where you're applying. Now you've narrowed down your list from 40 schools to the 20 schools that you want to apply to, and you're ready to sit and start your application. Think about the mission statement of the school, and this is connected to how you choose where you want to apply. Are you in line with their mission statement? If that school is looking for service, and they will continue to encourage volunteer work while you are in medical school, is that something you want to do? Will the school have a series of research papers due? And do you want to encounter that? So know the school, know their mission, know their curriculum, know what they will be teaching you. Are they teaching you their first 2 years, that standard curriculum with your sciences and body systems, or do they switch the order up and incorporate it over a 4-year period? Know what you're getting yourself into. When you start that application, do your due diligence also. What is their prerequisite coursework? Many schools will have a set requirement of courses that must be taken prior to admission. At some schools, there's no leeway, and you must complete their courses. At other schools, they might make exceptions to those courses, perhaps looking at your experience, or perhaps they will be taking a substitute course, or they might look at your MCAT and show proficiency there. But every school is different. The majority of schools have a standard prerequisite coursework. Typically, it's 1 year of biology, 2 years of chemistry, and a year of physics. Within those guidelines, there are little tweaks that might vary from school to school. Make sure you know the GPA and MCAT requirements of the school you're applying to. Some schools have cutoffs. If it says on their website that a school has a cutoff of a 3.5 and you have a 2.9, and they're firm with the cutoffs, don't waste your time and money applying. It's going to be an effort and futility, excuse me, and you will get very frustrated and you will lose your money. Other schools take a holistic approach and might say, yes, we have guidelines that you should follow, but they're not set in stone. We will look at your entire application holistically, and there might be some leeway on that GPA or MCAT score. So make sure you know what the school's policy is to know where you fall. Even in a school where there is no cutoffs for GPA or MCAT, you still should try to find what their average scores are so that you could remain competitive. You want to bring your scores as close to that average as you can. It's very competitive out there. There's a lot of very, very qualified applicants, and you want to make sure that you are in the mainstream and you are in the top of the pool. So if the average MCAT of a school is 512, and you know you have a 502, you might want to ensure perhaps your GPA is very strong. And if they're taking a holistic approach, they might look at that. They might look at the academic trends on your transcript, but know what the school is doing before you apply. It will help you in that weeding out process of where to apply. Letters of recommendation. How many and from who? Again, every school is different. Some schools will require 5 letters, some will require 2 letters. Some will have no limit on the number of letters you can submit. If a school has no limit, be careful. I would still not recommend bombarding the readers of those applications with 15 letters. Remember, your application is being read by several people, and you want everybody to read what's on your application. You don't want them to get tired after reading 6 or 7 letters and then start skimming them. You want them read. So think carefully who you are asking to submit those letters. Are you asking your elementary school teacher who you are still in touch with? Might not be the best choice for a medical school. I strongly recommend that you submit some academic references, people who have seen you in a classroom. Some schools have that as a requirement. If you've been working, you might want to show how you are in a work environment. Does that show that you collaborate well with people? So think carefully who you're asking to submit these letters and write them for you. When you ask your referees to submit letters, remind them very politely, of course, because remember, they're doing you a favor by writing these letters. They're asking you, remind them of when you would need it submitted by. If you submitted your application in September and the referee does not submit their letters until December, your application is not going to be reviewed until all your letters are submitted. So I strongly recommend that you reach out to your referees as early as possible. You could ask them to even submit those letters, load them up to Interfolio so that by the time you need to submit them, you can get them in a timely fashion. Think about whether the school you're applying to is going to look kindly on service, volunteer work, or research. Every school is different. There are definitely schools that are looking for intense research. Have you published already prior to going to medical school? Is this something that you're interested in? If this is what you're seeking, a program that's very research intensive, you're going to have to show some initiative to that prior, probably on your application. Other schools would like to see some depth. You want to be a physician. You're going to be helping people. Have you already had a demonstrated volunteer work? Have you already done this? And it doesn't necessarily need to fit a checklist. I strongly suggest do what really resonates with you. Do what you are passionate about, because that is where, again, you will succeed, and then the school will be a good fit for you. When you write your CV, include in your CV the things that are important, the highlights. You don't want to go into minutia for everything you've done all 4 years of college. However, you do want to give a representation of what that school is looking for. So you might have to change your CV for different schools. If a school is intensive on research opportunities, you might want to include more research, more articles you've published or things that you've worked on. If a school is more intensive for service, then you might want to include several service opportunities that you've done all through college. So know what you're applying. I would suggest having a shell for your CV. Some things don't change anywhere that you're submitting. So for instance, your basic information, your education, your work experience will be the same. But then when you get into the other extra items, think carefully where you're applying. Sometimes if you have room, it's always good to also put on some things that are of interest to you. What hobbies do you have? That's always an interesting, gives insight to the applicants. I strongly suggest you try to keep your CV to no more than 2 pages. If you can put it on one, that's great. 2 is fine. but don't go any further than that. You should be able to narrow down your experiences to 2 pages. Last but not least, one of the most important parts of your application is your personal statement or essays. Some schools have the set essays. AMCAS has certain essay requirements, and other schools that are not through AMCAS have very distinct essays unique to their programs. Make sure that you read the essays. Read the requirements. What are they looking for? In these essays, this is an opportunity for you to share with the reader, with the admissions committee, something that they're not seeing elsewhere in their application, something that about yourself that you do not see from reading your application, something you don't see from your CV. Perhaps, why are you going into medicine? Tell us a little bit more about yourself. And that's always helpful. You don't want to be repetitive on the application, because remember, the reviewers of your application will be reviewing everything. So what we get from that CV, we'd like to learn more from the essays. And here too, consistent with what I've already said, know where you are applying. It's very important to gear your essays properly. Just one note there. For instance, I've heard if your school is located in the middle of the Midwest, you don't want to say in those essays, I love the beach. So you make sure you know where you're applying. So let's move on now a little bit more, go in depth with these essays, these personal statements, some common do's and don'ts to help you with the essay. As some of these I've already mentioned, for instance, answer the question. If they are asking you a question, address the question. Don't write an essay about what you want to write and make the point that you want, but address what they are asking you. Tell a story, do an outline. You have to give these essays thought. You can't do them on a whim. Have an outline. Just a reminder, please, can everybody please mute themselves? I see several people.
My bad.
Thank you. Thank you very much. So have an outline. Know what you want to say in these essays. Now, if you do an outline, even if they're asking you a question, there are ways you could probably integrate a point you would like to make. So that means prioritizing what you want to include and follow the guidelines. When you write these essays, it's better you want to share information about yourself, but you don't want to share it about, I have done this, I have done that. Again, we will see that on your CV and we'll see that on your application. But yes, you did certain things and you have certain experiences, but what have you learned from those experiences? Did you grow as a person? Have they helped you on your path to becoming a physician? That would be helpful to the reader to know. Again, can't stress it again enough, know where you are applying, and that will help you with your outline. Use this again as an opportunity for your personality to come through. The school wants to get to know you better. They want to know who is the person behind this application. Be aware of yourself, your actions, your experiences. And it seems very obvious, but proofread and edit your essay. Make sure your English is correct, your grammar is correct. You do not want to have any typos or spelling mistakes. I strongly suggest you show these essays to other people. If you have a pre-health advisor, include them in the process of writing these essays. Perhaps a friend. When you look at an essay too many times, sometimes you don't see an obvious mistake or something that needs to be cleaned up, or perhaps you're repeating a theme. So get feedback from several people, not just one person. It really will enhance your essay. Some don'ts, all these things that I just mentioned, all these points cannot be done on the fly. They cannot be done very quickly. Give yourself adequate time to plan, write, and review your essay. Don't leave it to the minute before you have to send that application in. Again, I mentioned this before, don't repeat that CV. One very obvious point again, but I must reiterate it, try to avoid controversial topics. And there's no shortage of those right now, unfortunately. You do not know who is going to be reading your essay. You don't know where they stand on a controversial topic. Try to steer clear of those and do more on general things that have helped you grow as a person. Don't use terms or cliches or books that you've read that you know that are just part of that everybody has read. You want to be specific to you. Again, we know we want to learn more about this applicant. And last but not least, if you were meeting someone in person, you wouldn't want to be negative. You would try to be upbeat and smile, put your best foot forward. Don't be negative in your essays. That will come through, and that would come through when you're a physician. Remember, when we read these essays, we're trying to see who will be a successful physician 10 years from now. Will we want them to be our doctors? Once your application is in, the next step is if you will be invited for an interview. If you succeed in passing through to this step, then congratulations. Now, some of these interviews aren't historically been in person. Since the pandemic, most of these interviews are now on Zoom. I've spoken to several of our colleagues. Some schools are returning to in-person interviews, but the majority will still be conducting interviews on Zoom this year. And I don't know if you might be playing several years down. The truth is, whether you will be interviewing on Zoom or in person, these rules and these guidelines are the same. You need to dress professionally. Whether you're interviewing on Zoom or you're interviewing in person, you want to be a professional. Put a suit on, put on a very business attire is what you should be striving for. I know there are a lot of jokes that are made about Zoom interviews that you only need to be dressed from the top. I don't subscribe to that. I strongly recommend get dressed even if you're on a Zoom interview, because it will put you in the mindset of being a professional, and it will come through that you're professional on that interview. Remember, just like you've been on Zoom, interviewers have been on Zoom, and we've learned how to pick up cues. We learn how to pick up cues, we learn how to read people on Zoom. So even though you're on Zoom, again, these guidelines stay the same. Practice, role play. Here you will need to reach out to somebody, do mock interviews, have them do it several times with different types of questions. Some more challenging, some easy ones. Know your application. When you go into that interview, I strongly suggest you review the application that you sent to that school. Again, you might have sent different essays to different schools. You might have had different CVs for different schools. Be familiar with what that reader has seen, because they might ask you a question on that application and you want to be able to address it properly. There are certain basic questions that you can anticipate. You might be asked them, you might not. But why you want to be a physician? Why do you want to go into the field of medicine? If you asked to share something about yourself, have those type of answers already. You don't want to sound scripted, but you want to sound prepared. Again, do your homework about the school so you don't ask questions that are not pertinent. Some of the questions might be like what I mentioned earlier. You might be asking about the location of the school, as if it's in the city and how you get around, but the school's located in a rural campus. That shows you did not do your homework. Know what, again, a lot of this is a little bit repetitive now from when you wrote your essay. Know the attributes and what the medical schools are looking for. They're looking for who will be a successful and compassionate physician in 10 years. So show empathy. Do you have the skills to problem solve, to figure out a diagnosis? Know what they're looking for. As I mentioned, treat these virtual, if it's on Zoom, the same way you would treat it if you are in person. Try to maintain eye contact. Know where your screen is. You can even practice talking on the screen. Practice with another person so they could see how you're coming across on the Zoom. Don't keep looking down at your phone, even if you're in a Zoom. We don't know if you're looking on the phone or you're typing. You would certainly not be doing that on an in-person interview. So don't do it on a Zoom interview either. And be polite and make sure you follow up. The interviewer might ask if you have any follow-up questions. Ask them if you have them. Thank your interviewers. They've taken the time to meet with you. Show that you appreciate that time was spent.
Thanks, Beth. So as I mentioned, we're going to open it up for Q&A in a few minutes, but we just want to go over some basic information now about MSIH and some specific things we do in regards to the medical school admissions process. I also got a question in the chat while Beth was presenting just about whether this presentation will be available afterwards. And yes, I will send out a link to everybody of the recorded session. So if you want to look at it again, look at some slides again, please feel free to go right ahead. So MSIH is a unique medical school that was founded over 20 years ago now by two physicians, one at Columbia University in New York and one at Ben Gurion University in Israel. They've done a lot of global health work together. And they realized the world was changing. People were migrating more. With that, diseases were traveling more than ever before, faster than ever before. And physicians and healthcare providers were encountering a much more diverse patient population than ever before. So it was really important, they felt, to have a medical school that focused on global health, focused on cultural competency. There were many medical schools out there that touched upon it. There's more now than there used to be, but there really was no medical school in the world that really integrated it into all 4 years of the curriculum. So MSIH was founded, like I said, over 20 years ago, about 25 years ago now, really as an innovative medical school to prepare physicians to practice medicine, whether locally or internationally, but to have more of a global mindset, to be aware of social determinants of health, to have better training and cultural competency, and really be able to work with diverse patient populations, no matter where they would exist around the world. Some more specifics about the Medical School for International Health. It is a 4-year MD program at Ben Gurion University in Israel. The classes are all taught in English with the exception of Hebrew instruction. But I always say to people, it's hard enough to learn biochemistry in English, forget about learning it in a different language that you may not speak or not speak very well. So all the classes are in English. The first 3 years of instruction all take place at Ben Gurion University in Israel. Students in the 4th year get to choose where they want to complete that 4th year based on where they want to do residency. We do include Hebrew instruction in the curriculum, really aimed at our students being able to interact with patients. Some patients may speak Hebrew exclusively, and so that the students have are better able to interact, better able to take a patient history, things like that. Not so much focused on writing and reading in Hebrew, but really conversational Hebrew. And the classes are leveled, so we have some students who do come in speaking Hebrew, and they'll focus more on medical terminology in Hebrew. With that said, and I'm going to touch upon this in a minute or so, where we're located in Beersheba is a very diverse area in Israel. So as much as students will hear English or Hebrew spoken, they'll also hear Arabic spoken, Russian spoken, a whole bunch of North African dialects. So it's really a great place to train as a physician and train as a physician who is much more versed in global health, versed in treating diverse patient populations, able to interact with patients from all different backgrounds. It's really a great place to train if you want to be that type of physician. Year 1 and year 2 are very similar to what the experience you have at most other medical schools, with them being primarily classroom-based. You're focusing on the basic medical sciences, first year, biochemistry, microbiology, things like that that you may have had in undergrad, but at a higher level now. The second year, we always hear students say you see the dots being connected. So you learn about body systems. You learn about the neurological system or the cardiovascular system, and all of those basic sciences you learned, now you see the connections to medicine and why that was so important to learn all of those things along the way. In year one, our students do also take a year-long introduction to global health course. It's a phenomenal course taught by an epidemiologist and a medical anthropologist. And so students really get a perspective on all different things related to global health. So often students say it's one of their favorite classes. What we also do that's a little different is in year one and year two, students get to pick global health modules each semester, which is the equivalent of an elective. Our students, again, really love those classes. It's something different than the science classes that they're taking, the really tougher science curriculum in medical school. They could be courses like sociology and medicine, health of the urban poor, mindfulness in medicine, refugee health, history of medicine, all different courses like that. And students get to pick what interests them and take those courses. There is clinical work in the first and second year. Again, in the beginning, focused on how do you take a patient history. But what's unique about MSIH is maybe how do you take a patient history with somebody who doesn't speak the same language as you do, or somebody who comes from a very different background than you do. At the end of year two, students are prepared to take the USMLE Step 1 exam, just as they would if they were going to school in the States. And there's mandatory test prep integrated into the curriculum for that. So students are really prepared for the USMLE Step 1. It also, the preparation for that prepares students who want to stay in Israel because they can submit their Step 1 to stay in Israel for residency. And it also prepares students to take the exam in Canada because the material is very similar in terms of preparing for that. At the end of 4 years, MSIH graduates receive an MD degree as well as a global health certificate. So I talked a little bit about years 1 and year 2, which I said are more classroom-based, although there is clinical work as well. Year 3 and 4 are almost entirely clinical-based. So again, I mentioned before, where we're located in Beersheba, students get great clinical exposure to the diverse patient population that exists there. There's the Bedouin communities, the Ethiopian communities. There's a lot of immigrants from the former Soviet Union, Africa, the Americas, Middle East. So students really learn how to interact. What they learn how to, as I mentioned, talk to a patient who speaks a different language they do. They learn about how one question can be appropriate for one patient, but be offensive to somebody from a different background. They learn about social determinants of health. They learn about political, economic, all different things that may impact the health of individuals as well as populations. In the third year, students also participate in some cross-cultural communications workshops, again, preparing them to be physicians to practice anywhere in the world with a diverse patient population. In the fourth year, students have a choice. So some students want to stay in Israel and complete residency there, and that's fine. They can complete their clinical electives in the fourth year in Israel. The vast majority of our students will come back to North America and do their clinical rotations in the fourth year in North America, in the US or in Canada. Electives are done throughout North America. We do have some hospitals that we have arrangements with for those electives. Columbia University, which I've said we've had a relationship with since inception. Also Hofstra, New York Medical College is going to be a new one, University of Tennessee. So various hospitals in North America that kind of spots set aside for our students. And then also other hospitals throughout North America. Students are given a list of every hospital any of our alumni have ever done an elective at. Alumni are a great resource. We have electives coordinators on both sides of the Atlantic, so in Israel and in New York, who help students so that they can pick and choose where they want to do their electives in the fourth year. They may choose to do 2 of their electives at one of the hospitals we have a relationship with, and then they may choose to do their other 2 or 3 clinical rotations at hospitals based on where they want to do residency or what they want to do residency in. And what I mean by that is a student may be from California, so they may go do 2 clinical rotations out in California. It's a great way to make some connections for residency placements. They may be interested in pediatrics, so they may want to work down at CHOP, to clinical rotation at CHOP in Philly or Rainbow Babies Hospital in Cleveland. So really they get a lot of advising about the whole process, and it gives them a lot of options in the 4th year if they choose to do their electives in North America. There's also advising for students who, like I said, want to stay in Israel as to doing those electives in Israel in the 4th year as well. We have an alum who's on staff now and really advises students who want to go about that option as well. That's kind of the first half of the 4th year. The second half of the 4th year, students complete a global health clerkship. And this is a really unbelievable experience. MSIH graduates usually say, I graduated in 2010 and I did my clerkship in India. It's just part of their MSIH experience that they really point out all the time. I think it leaves a lasting impression. But the students get to go for 2 months to one of the different clinical sites that we have. Most of these sites we've had for many, many years now, some since inception of the program. And they're sites that we work very closely with. And the students get to go experience how the healthcare providers there, the medical students and the physicians, are able to provide the quality care that they're able to provide despite the limited resources they have. They really get to hone in on some of their skills that may sometimes get washed away a little bit with all the technology that we have here in the US and in Israel. But some of the sites, as you can see, are there in Nepal, India, Sri Lanka, Ethiopia, Ghana, Mexico, Peru, Canada. Those are some of the locations we've done in previous years. But it's really an unbelievable experience that the students get to have, and very unique to MSIH. We've actually been cited by some academics in North America as really the model for that global health clerkship experience, to make it mutually beneficial for both our students and for the sites that we work closely with.
So now you've graduated, what happens next? We have our students, our graduates are doing very well on their residency placements. We provide a path to residency really parallel to the top medical schools in the United States. When our students are preparing to go out for residency interviews, as Kelly was sharing, that global health experience is really unique to our program. And when interview season comes, our students are amazed about how that unique experience is memorable to not just them, but also to their interviewers. They want to hear about this experience. They want to hear what you've learned. It's really a unique opportunity to shine. We assist our students along with how to apply for residency. Our students are addressed every year by the dean from Columbia University, with whom we have a very close relationship. And she will address our students on how to apply to residency, when to begin, when to load all their information to ERAS, when should they, what should they be wearing on their interview. She will go through in minute detail, avoid this color, wear that color, wear a tie, get a haircut, make sure you're groomed properly. She will go through every possible detail, and it's really a tremendous resource. In addition to that, our own director of the North American office will address our students and guide them through the residency applications. Because of that, our students are being placed in top institutions all over the world. For instance, Drexel University, Johns Hopkins University, University of Maryland, Cedars-Sinai in Los Angeles, University of Toronto, Lenox Hill, Columbia University, New York Presbyterian Columbia in New York, and also in Israel. Our students, we have always every year several students who choose to stay in Israel. And those students, as those graduates, are being placed in top institutions in the country as well, such as Soroka University Hospital, Shari Tzedek, Hadassah and Kerem, Tel Aviv Ichilov Hospital. So our students are being placed at top institutions, but that's not for everybody. Some graduates prefer to go into a smaller facility, such as a CMD or a local Klalit or a local, just a private practice. And we have many graduates doing that as well. You are uniquely trained to go whichever route you choose. The majority of our graduates are practicing in the primary fields of medicine, such as internal medicine, family medicine, emergency medicine, peds, OBGYN. But we also have a significant pool of graduates that are practicing psychology, neurology, anesthesiology, surgery. And we even have some graduates that have gone into ophthalmology, which is one of the hardest fields to match in. I believe last year we had one that even matched. And I mean, since I'm here, I've seen several match in ophthalmology. What's important to note is that our graduates are not just matching at top institutions, but very often, most of the time, they are matching in the fields of their choice and at their top choices of where to practice. And that's very important to note. Just some information you might want to jot down if you'd like to learn more about our program. Our website is msih.bgu.acil. I really encourage you to navigate the website. There's a wealth of information there, and you can really learn about the program, about the curriculum. A lot is on that website. If you have any questions, Kelly will be sharing our emails with you. You can reach out to either Kelly or myself. I personally monitor this MSIH admissions. If you have questions about admissions, I'll be happy to answer them for you. We have, there is a link on our website to our first year blogs. Every year we ask for volunteers in our first year class to volunteer for a month and write 3 or 4 blogs. These blogs really give you insight into what it is to be an MSIH student, both from an academic standpoint and a social standpoint, and a way of living in Israel. And the blogs represent so many different personalities. We don't ask them, we don't tell them what to write. We really give our students carte blanche to write about what they feel their experience is. You will read all sorts of experiences. You will see insights from very different personalities. So if you want to learn what it is to be an MSIH student, I really encourage you to look at that link and read some of those. Right now, I think maybe we'll stop sharing the screen and we'll open up